What is the definition of hyperlipidemia? Hyperlipidemia is a medicinal expression for abnormal elevated levels of lipids or fats in the blood. The two main kinds of lipids which are found in the blood are cholesterol and triglycerides. Reasons of hyperlipidemia. The major reason of hyperlipidemia comprises modifications in lifestyle practices in which risk factor is fundamentally indigenous food, for example, with a fat ingestion more than 40% of overall calories, saturated fat ingestion more than 10% of overall calories, and cholesterol ingestion more than 300 milligrams per day or treatable medicinal conditions. The abnormal cholesterol standards are the outcomes of an unhealthy lifestyle containing taking high-fat food and other lifestyle agents like smoking, intensive alcohol usage, being overweight, and loss of exercise. Other agents include kidney illness, diabetes, and an underactive thyroid gland, and as well pregnancy. Other diseases that may increase cholesterol standards include kidney illness and polycystic ovarian syndrome. The higher standards of female hormones such as estrogen have been recorded to elevate or change the cholesterol standards. Furthermore, drugs like beta blockers, diuretics, and drugs used to heal depression have also been recorded to increase cholesterol standards. Another modifying agents in the progression of hyperlipidemia are gender and age. It has been offered that cholesterol standards increase as the individual gets older. Heredity has also become a modifying agent for the development of hyperlipidemia, as well it has been recorded that the genes partly define the amount of cholesterol body produces. It has also been recorded that metabolic syndrome, chronic renal failure, and nephrotic syndrome can predispose to hyperlipidemia.